Now, I'm really excited to talk about which patients that might benefit from RECALDENT technology. So, for starters, obviously we're talking about tooth decay and patients that have dental caries or oral imbalances or patients that suffer from xerostomia. And these patients absolutely positively would benefit from RECALDENT technology because of all of the features that RECALDENT offers. Now, I also like to talk about the repair of incipient lesions or early lesions. I found that we can stabilize lesions or sometimes even reverse lesions if we can get our patients to be compliant with risk management recommendations and also the incorporation of RECALDENT into their oral hygiene practices. Patients that have an acidic oral environment or patients that suffer from acid reflux or various GI disorders, any type of RECALDENT product is going to help boost their resting oral pH. So this is going to be helpful from the standpoint of their teeth and also their soft tissue structures as well. Now, I really would like to take a minute as we sort of finish up here to talk about cosmetic dentistry and even implant cases, because as I mentioned, MIPaste Plus or MIPaste 1 has a very low RDA. Now, I know that RDA has kind of really hit the presses a lot lately because of abrasivity of teeth and different toothpaste that run the gamut of different types of, that present with different RDAs. Well, a couple of things that are really important to talk about is the RDA scale was really intended to identify the toothpaste's ability to remove stain, and in doing so, whether or not it's going to be abrasive to dentin. And so we know that if a patient has perfectly healthy enamel, pretty much they can use any toothpaste and they'll be just fine. Now, as a prosthodontist or even as a hygienist in restorative practices, I can tell you that nowadays patients don't present with teeth that are just made of enamel or dentin or cementum, but there's a high population of patients that present with cosmetic bonding or restorative bonding or porcelain veneers or CAD/CAM restorations or PFM crowns or gold crowns for that matter, or onlays or inlays. Now, we have to also consider the abrasivity of the products that we're using, specifically products patients go home with, but also products that we use as prophylaxis pastes and things like that, because if you can imagine that a paste that could possibly wear away dentin, that a paste can, without a doubt, take the luster off of a composite or start to break, or some prophy paste can start to break down the cavo-surface margin between a composite and a tooth. And so sometimes when we see composites that have stained margins, we can actually start wondering is it something that occurred iatrogenically because of some of the products that we're using in our practices, the products that patients are going home to clean their teeth with. Now, excessively abrasive products can also take the luster off of CAD/CAM crowns, especially if you're doing CAD/CAM in your office and you're only providing a surface stain and glaze to that restoration. And even highly abrasive prophy paste can take the stain and eventually the glaze and eventually the stain off of our crowns, which could negatively impact the long-term aesthetics of our restorations. So when it comes to restorative patients, patients with lithium disilicate restorations or any type of zirconia or composite restorations, I believe that we should go less is more when it comes to abrasivity.